and be able to help people going through the financial stress of cancer. I've been in healthcare for about 30 years. It's been my experience that when a patient gets the shocking diagnosis of cancer, feelings of panic and fear could overwhelm them. Thoughts of being defeated could begin before their road to health even starts. They might be afraid that they just can't afford it with or without insurance. For patients that have commercial insurance, the Financial Navigator will investigate and assist with ensuring that the patient understands their insurance company's coverage, deductibles, and out-of-pocket expenses. You want to make sure the patient needs to make sure that they are in network with the provider and the facility. The facility should have guidelines on their in and out of network. If the patient's insurance then does not have a network, that means that the patient can be balance billed because there's no contract with their insurance company. Asking for assistance after the plan of care has been established is important to identify pharmaceutical assistance that may be available for you. An example of that is if a patient is getting Infinzia, they can go onto the website below and get assistance. Usually, most facilities have a pharmaceutical team that will help them get registered for that, and that will help them with their out-of-pocket costs. If your provider refers you to an out-of-network facility, or if there is no network, it is possible to have a single case agreement. Because sometimes, like one hospital may have a specialist over another hospital. Any questions so far? Okay, next. Commercially insured hurdles. Financial navigators have a selection of foundations available to help patients when they have they have foundations that are available with different cancers. They come and go. You never know when a foundation is going to be open. And it's based on the federal poverty level, usually between 400 and 500%. On the next page, I have 2020 poverty level guidelines that give you an idea. It's actually a lot more than what you think it is. So more people qualify, even if they think they don't. And then Fund Finder is the foundation link that we usually go to as one of the main ones, because like Fund Finder has like several different foundations linked into one, and you can look for your particular diagnosis, and then they'll tell you if it's open or closed or not. So you don't have to look through 5 different websites. You can look through one to kind of help narrow that down.
Do you happen to know, I know that historically lung cancer has not had a lot of funding for patients, whereas some of the other cancers have a lot more foundations that support that. Do you happen to know or remember if there are any lung cancer specific foundations that help patients? Do you know off the top of your head?
Well, I mean, they do open and close quickly. With Fund Finder, when you log in, you can set, for me, I set, I have them send me an email or text message every time a foundation opens up for a particular type of cancer. So as soon as they notify me, I'm on it. If I already have someone that needs something that I already know, then I'm on it.
So can we do that as individuals?
Absolutely. Absolutely. Okay. And this is an awesome website. And this is just an example of the poverty levels. I don't have one for 2021. They haven't come up with it yet. But if you look at the 400 level, it's actually pretty reasonable. Like one person, if they make $51,000 a year, they can still get assistance. most people think they have to make very minimum to get assistance, and that's just not the case. It is accessible. If a patient has commercially insured insurance and they lose their job or they go on short-term, long-term disability and they're going to lose their insurance and they are still actively in treatment, most facilities will have a COBRA plan. And what that means is facilities will pay for your COBRA premiums, because as we know, COBRA premiums are very expensive. Most people can't afford them. There's guidelines, of course, there's applications for that. But if you look at it at a business perspective, it's going to be more cost effective for a facility to pay for someone's premium as opposed to someone not having insurance at all. So that's why it makes sense whenever they're actively in treatment for us to pay for their premium. These are options whenever you are transitioning to Medicare, just different things to think about. You want to compare all your options. So you're comparing apples to apples. It's like the first option is to have Medicare A, B, D, and a supplemental. You want to figure out that cost per year, and then you can figure out your Medicare Advantage, which is Medicare Part C. You want to find out what if you're going through cancer treatment, you can pretty much guarantee you're going to have to meet that $6,900 per year. So, and then also whenever you are becoming of age for Medicare, you have all these vultures calling you, telling you about Medicare Advantage. And it's not all it's cracked up to be, because they tell you because they want you to get their plan. But with the Medicare Advantage plan, you're going to have to pay that $6,900. And when they try to sell it to you, they always say, "Oh, you're never going to meet that amount." Well, yes, you are. If you're going through cancer, you guarantee you are going to meet that dollar amount. So you want to figure out your supplemental plan and compare the dollar amounts per year to make sure you have the best option. And then if you choose not to go with either one of those and just choose A and B, your deductible will be 20% of the total of the Medicare allowed amount. And you think 20%, oh, that's not that much. Yes, it is. Because if someone is getting, say, Opdivo or for lung cancer, their 20% is $2,500 per month. That's just their 20%. And that's insane. So that's why it is important to get a supplement plan or a Medicare Advantage plan, because at least you're going to have a max out of pocket. I know that with supplemental plans, sometimes they vary in cost. So that's why it's important to just compare, because something's better than nothing. As you can see, that $2,500 adds up quickly.
Well, I just wanted to comment that that 20%, when you're talking about some of these targeted therapies, that could, it could be, double that, 25, it could be 5,000 and even higher for some of these targeted therapies at 20%.
Absolutely. For some pharmaceutical companies will help Medicare patients that only have Part A and B. But you just have to ask. Always ask. The worst thing that can happen is they say no, but at least you tried. And to see because some pharmaceutical companies will only help non-Medicare patients or non-federal funded insurance patients. And then you have some that will. So you just never know what the case may be. And also, sorry, one more thought. With whenever you're transitioning into Medicare, you have like a 6-month window that is your golden window that you can choose between your traditional and supplement or the Medicare Advantage plan. Say that you choose the Medicare Advantage plan because you don't know any different, you haven't compared anything, but you chose the Medicare Advantage plan because someone called you and told you it was a great plan. After that 6-month window, you're going to be stuck with that because the supplemental plan, after that 6-month window, you're going to have to pay. You'll have to have an underwriter. You'll have to be approved, and you have a cancer diagnosis, so you're probably going to have an extremely high premium for that supplement. So that's why it's important to look at all your options once you get Medicare. I know that in South Carolina, if you're under the age of 65, you can only get Medicare Advantage. That's your only choice until you turn 65. So when you turn 65, that you still have that open window.
Joe, I'm just going to jump in if you don't mind. Here in North Carolina, and I don't know how it might differ from there in South Carolina, but my friends who have lung cancer, who are younger than 65, who of course, who don't have the regular Medicare, but they've got because of their disability, they've got to get a supplemental plan. They can buy it, but it's extremely expensive because they know, even though they're supposed to not be able to discriminate, they know that if you're on Medicare and you're younger than 65, that means you're disabled, most likely. So they charge, it's like many times over what they would charge somebody who's 65 and gets a supplemental plan.
Yes, that is correct. In my cousin's case, whenever she had the phone call for the Medicare Advantage, we followed this plan to find out the big picture of things. She doesn't have cancer, but she has other medical problems that come and go. So she never knows what she's going to pay per year. So we figured out the most she'll pay and then her supplemental plan. And it really came out to be about the same dollar amount. So for her, it's kind of the middle of the road. Either direction would be okay with her. She is either going to pay that money per month or she's going to pay it when she uses it. So at that point, it's a toss up. But when she turns 65, that supplemental plan, that dollar amount will change because it starts over when you turn 65 fresh. You have that 6-month window. For Medicare also has savings programs. They have, and I've attached the website. Definitely go on it and look through different things. Well, if you have Medicare, you have to have Medicare in order to qualify for this. They have pharmacy plans that you only have to pay like $3 to $6 for your prescriptions. And on this website, it also gives you the guidelines. It's actually fairly acceptable, that it's reachable, that you can get. They have programs to where they will pay for your Medicare premiums, or you can get full Medicaid that picks up that 20%. They have a few different things that can help Medicare patients. Well, we've already talked about a little bit about being self-pay. Definitely make sure that you go on the healthcare.gov website. There's a lot of websites, if you go to healthcare.com or looking for low insurance, affordable insurance, a lot of that is really bogus. They tell you, they'll pay for like 3 office visits a year, $75 per visit. Well, we know that's not realistic. Or they tell you they'll pay, $400 for an inpatient stay. Well, we also know that's not realistic. But you're paying money for this junk insurance. So it's just not. Always go to .gov. And there's different rules with that you can apply for insurance with the government. with the .gov or Marketplace rather. If you lose your job, you can apply for Marketplace. If you get denied Medicaid, you can get Marketplace. If you have a life event, if you get married, adoption, if your spouse passes away, marriage, if you move, those are events that you can get Marketplace. If like a lot of our patients that are self-pay, if they apply for Medicaid and they get denied, but they have to do it. They have to apply for Medicaid and get that denial letter because they were denied Medicaid. At that point, they can get Marketplace. That's a little loophole. So also with facilities, the Financial Navigator can help you. Most places would help you with a hardship application or a charity application. I can speak for Levine that like when someone owes like $2,500 because of their deductibles, and we know deductibles are high these days, we will offer a hardship application. They fill it out, and then there's another team that will go over it. Most people will get a 25% discount. That's on average, but some get a bigger discount. It just varies. The charity application is for people who don't have insurance. Like if you start out without insurance and you have, well, honestly, a lot of times people with cancer, they find out by accident and they may not have insurance because they can't afford it or think they can't afford it, and everything's great. They're going through life and they end up with cancer, but you end up in the ER for one reason. And like I had one person that he was in a car accident. He didn't know he had cancer. When he went to the ER because of the car accident, he had stage 4 cancer. But he would have never known if he didn't have that car accident. So things just happen unexpectedly. You should always hope for the best, prepare for the worst. And with insurance, something is better than nothing at all. Because at least you know that there'll be a cap at the end.
Is what?
Because we know there'll be a cap at the end. Like if you had Marketplace insurance and you can only afford a high deductible plan, it's okay. Even though you know you're not going to be able to pay that $8,000 deductible, it's okay. But at least you know that's going to be the max you're going to have to pay is $8,000. And then the facilities, they can help you through that. And again, don't use a credit card. So there's always ask for help. And a lot of times people are afraid to ask for help because they think that they're not going to get it because they're not poor enough or just don't want to ask or don't know to ask. Always ask questions. Never be afraid to ask questions. Everything's possible. The worst thing that can happen is no, but always ask for anything, any type of assistance.
Okay.
Even if you need travel assistance, or if you are going through treatment in a different part of the state and you need lodging, there's a lot of different options out there. You just have to find them. And that's all I got. There's my email address. Feel free to call me, email me with anything. And we'll just work through things together.